Hello, and thank you for joining me today to share with you a little bit about Maryland Children's Alliance, our partnership with Maryland CHAMP, and what a Child Advocacy Center is, especially as it relates to our medical provider partners. I want to share with you some information about the Child Advocacy Center and multidisciplinary team model, about Maryland Children's Alliance and the National Child Advocacy Center Network through the National Children's Alliance Standards for Accredited Members. We're going to focus on the multidisciplinary team standard, the medical standard, and the case review standard as well. Child advocacy centers in Maryland focus right now on child sexual abuse cases, but they do also see physical abuse and other types of child maltreatment. So it depends which advocacy center you're partnered with, what types of child abuse cases you'll be seeing, but you most definitely will be working with children who are alleged victims of child sexual abuse. Child physical abuse is becoming much more frequent. And in the next iteration of the National Standards for Accredited Members, you may be asked to become an expert in that as well. One thing to remember as we think about even one child who suffers from maltreatment is one too many. Our child advocacy centers offer a wide range of support to every child and family who comes to them. The medical support is one that we offer. Just like mental health or the victim advocate may offer some sorts of services around housing or around food, around schooling and things like that. But it's important to note that everything we offer at the Child Advocacy Center is always at the final discretion of the caregiver, of the family, and of the child. So it's important for you as a medical partner to create that strong relationship with your Child Advocacy Center staff, including the victim advocate, to understand and be able to explain the medical procedures and processes so that the Child Advocacy Center staff is making the recommendation to many of its children to have that medical piece, but also to understand that the family may opt out. And that's not a reflection on you or on the Child Advocacy Center. It's just a reality about the services and support the Child Advocacy Centers provide. So when we look at a Child Advocacy Center, what does it mean and why is it important? Maybe 35 years ago now, if a child was believed to have been or disclosed that they were abused, they had to go literally from building to building, from adult expert to adult expert, telling their story over and over and over again. And a prosecuting attorney at the time said, this is really onerous on the child. This is re-victimizing this child by making them tell this story so many times. And the story itself may lose some credibility as it's told and retold to the adult professionals who need to hear about it. And so he created the model of let's create a trauma-focused and child-friendly environment in what we call a children's or child advocacy center. And let's bring all those experts to that center so that the child comes to our center. We all come providing this circle of care around the child. And the child can tell their story one time to a trained and neutral forensic interviewer. And all of the multidisciplinary team partners who want to hear that story can do it in real time and can interact with a forensic interviewer while that interview is going on to make sure that all of the important information is known as shared with the forensic interviewer and that he or she can then ask the right questions of the child. The Child Advocacy Center also serves as that one safe place that looks familiar to a child, looks comfortable, has toys and games. Maybe there's a facility dog there, and the child can feel safe in that environment, while all of those professionals representing the different disciplines can be there and help provide the support that the child and family need. In Maryland, every one of our jurisdictions, 24 of our jurisdictions, have a child advocacy center. The green dots represent those centers that are nationally accredited by the National Children's Alliance. The yellow dots represent those centers that are on the pathway toward accreditation. Now, accreditation is an onerous and long task. It can take 5 to 6 years before a center can put together all of the pieces of the puzzle, including that medical support, that medical service, that medical partnership, before that happens, and then the center can become accredited. Not only do centers have to go through a first-time accreditation with National Children's Alliance, but they also then have to go through reaccreditation every 5 years, and that's starting all over again. And we're going to talk about what that means as we look at 3 specific standards in just a minute. But your Child Advocacy Center, the one that you partner with as a medical professional, is not out there alone. You're a part of the statewide network of Maryland Children's Alliance. You're a part of the national network of National Children's Alliance. And Maryland Children's Alliance is a partner with the Southern Regional Children's Advocacy Center, or SRCAC. What that means is that we interact on a regular basis as chapters with our colleagues from Texas through Delaware. Big centers, big chapters, small chapters, multi-staff chapters, very few full-time staff chapters. And we're able to bring lots of great resources from these state partners back into Maryland for the benefit of our child advocacy centers. We're also able to share the great things that are done here in Maryland with our other state colleagues. Now, I know medical people have a language of their own, and we often, those of us not in the medical field, don't understand what you're saying, but child advocacy centers also have their own language. And you'll hear people talk in initials a great deal: CAC, MDT, ACEs, OMS. What do they all mean? As you become familiar with your child advocacy center partners, please ask if you don't know what the initials stand for. And also, as a caveat, please try not to use those initials when you're speaking to a child and family. It's really powerful to say Child Advocacy Center. Child is important, advocacy is important. It's important that the family hear that, because they may not, in their moment of crisis and trauma, know or remember what a CAC is. Instead of talking about the MDT, talk about the multidisciplinary team partners. Partners from lots of different agencies come together for your child to help support you and your family. But be aware that there is an internal language within child advocacy centers. There are standards that child advocacy centers have to meet in Maryland, because since 2019, we are part of Maryland statute. And so in order for an agency to call itself a child advocacy center, it has to not only meet the National Children's Alliance standards, but it also has to be a member of Maryland Children's Alliance in good standing. And that ensures that anywhere across our state, a child and family, as well as a medical professional, can know that the center that they're working with is working toward meeting and upholding the same level of standards across our state. Maryland Children's Alliance provides training and technical assistance to our child advocacy centers. And if you look on our website, you'll see a training calendar, and we include a lot of Maryland CHAMPS and other medical trainings on that calendar. You're welcome to access that. It's on our public pages. We also, from time to time, are asked to do specific projects, like the adaptation we did of our national standards for victims of child trafficking. And I encourage you to check that out, because there is a standard on the medical procedure, and we talk at some length. If you should encounter a victim of child trafficking, what are the unique qualities that you need to know? We're going to focus today, though, on our national standards. And we call it the Red and Blue Book, the standards for accredited members, and then the putting the standards into practice. And as you can see right now, we have 10 standards. Later this year, updated standards and new standards will be introduced to the network, so we can expect that the medical standard will be changed. But we're going to share today what we know about the multidisciplinary team standard, the medical standard, and the case review standard. So there are specific partners that have to be a member of the multidisciplinary team, and you can see them here. Oftentimes, the forensic interviewer from the Child Advocacy Center will also be a part of the MDT. Perhaps someone from the school system, someone from juvenile justice, someone from foster care. It just depends on the specifics of the case. But law enforcement, CPS, prosecution, medical, mental health, the victim advocate, and this Child Advocacy Center staff will always be partners. What's really important is to remember that every partner's voice needs to be heard about every child. And so while you share the medical perspective, it's important that you understand what the victim advocate knows and can share with you and with the multidisciplinary team about the child and family, what the mental health provider can share, how law enforcement sees this case going. Every voice needs to be heard. The essential criteria for the multidisciplinary team standard are the written interagency agreement. In Maryland, we call them memos of understanding, or MOUs. And this will be one of the first tasks you have in a partnership with your Child Advocacy Center to help create and draft this interagency agreement, and most importantly, to get it signed by your medical team, by your medical agency, as well as the Child Advocacy Center. The multidisciplinary team needs to have written protocols that you will be asked to learn about and to follow. And those protocols will talk about how your participation, what is it, how often does it happen, how do you share information but keep the confidential information safe at the same time. Your multidisciplinary team also needs to provide you with an opportunity for feedback. Sometimes it's done through what we call the OMS, the Outcomes Measurement Survey, but sometimes it's done through a Survey Monkey or just asking for feedback. And then there is training that the multidisciplinary team needs to provide to its members at its meetings, and it's important that you be available and fully invested in participating in that training. So that's a little bit about the multidisciplinary team standard. The medical evaluation is such an important piece. And as I said, I've spoken with a lot of medical providers across our state, and I know it is yours and their wish that every child receive a medical evaluation. But please remember again, that offer needs to be made, but it is not always taken. And so as you develop your relationship with your Child Advocacy Center, you'll find ways to help the victim advocate encourage that participation, help find ways to maybe speak to the family directly, and that'll be an important part that you play. The essential criteria for your medical standard obviously and naturally revolves a great deal around training and your training before you take on this role, as well as ongoing education requirements. So it is important, and I know how busy you all are, but it is important that you plan on meeting those education requirements and sharing those certificates of attendance or those medical certificates with your Child Advocacy Center so that they have them in order to report that information to National Children's Alliance. You'll also be asked to participate in a medical consultant review. This is for your benefit, to help you improve your skills, to help you problem solve with other professionals in the field, to help you and your Child Advocacy Center have that confidence to know that the advice you're giving is the very best. And then National Children's Alliance and Maryland Children's Alliance endorses this. Every service and support we provide at the Child Advocacy Center needs to be available to all of our clients without charge. And this is another issue that you'll want to discuss in your interagency agreement. How will your time, your expertise be paid for without putting that burden on the child and family who need us most? There are also rules and regulations around how you save and share your medical findings and how you document things. And then there are stipulations around how you share your information with the multidisciplinary team. The team needs to be respectful of your need to hold some things confidentially. You need to understand what is it, what level of information can I share with the team that will set them and us up for success in best helping and supporting this child and family. So if the multidisciplinary team is who does the work at the Child Advocacy Center, case review is what you do. And case review is so important, and we often confuse it with multidisciplinary team, and we talk about the two things as if they're the same activity. But one way to look at it is case review is how you discuss what's happened to this child, what your findings are, what the other team partners' findings are, and how will you best support this child and family moving forward. So protocols need to be set up, and you'll be a part of that discussion with your Child Advocacy Center for your case review. How does each meeting proceed? How often does it happen? It'll be important for you to know that as part of your obligation to the Child Advocacy Center, and therefore to the child victim that you're working on behalf of, you need to be available at least once a month for these meetings. And I've seen sometimes that a professional, like a medical professional, will come into the meeting just to talk about the child that they just saw, but they'll miss all the discussion on the other 3 or 4 cases that perhaps they didn't do an evaluation of. You have some expertise that even if you didn't do an evaluation of the other children, I encourage you to be available for the entire case review meeting, because you never know when you may have a great example or offer a great suggestion to the committee that they hadn't thought of. It's important that multidisciplinary team partners, again, be heard and be equally involved in case review so that the best decisions possible are made on behalf of this child and family. And then each multidisciplinary team will have a facilitator or coordinator. Some are just coordinators who help with the logistics. What's the date of the meeting? If you're doing it via Zoom, who has the Zoom link? What is the list of cases that we'll be reviewing, and what times will those reviews happen? But often too, there will be a designated facilitator who during case review will actually be leading and guiding the discussion. And if there should be conflict or a disconnect, that facilitator hopefully can bridge that gap for the whole committee and remind everyone this is about a child and family in crisis and they need us. So it's really important that this case review process include all of the partners equally engaged with a determination to come up with the best plan for this child and family's healing and for the best plan for each discipline's ultimate evaluation of the case itself. So that's a brief overview of the Child Advocacy Center model, Maryland Children's Alliance, and National Children's Alliance. And thank you for listening. If you have other questions or need to reach out, please don't hesitate to reach out to our staff. They're ready and able to help you in any way that they can. And if they can't, they know who to reach out to. We appreciate our partnership with Maryland CHAMP, and thank you so much.